I think a lot of doctors have told me that they would take the pill themselves if they got ill. I've had several on my show, including the past governor of Kansas, Dr. Collier, who's back practicing medicine, and he would take it himself, and he's giving it to his patients. ER doctors and who've actually gotten it themselves have taken the pill and told me about it. So that's what I'm hearing. In fact, the Dr. Ian Lipkin, who's probably the most famous virologist in the country, he was the medical director of the film Contagion. You remember that movie talking about widespread infection?
Sure do.
Sure. So he that's sort of his character in that movie. He actually was sent to China to help out, survived, came back, and then working at Columbia, my hospital. He's on the faculty with me there. Contracted COVID-19, and he treated himself with the medication after calling some colleagues and getting that advice from them that they would do it as well. So when the world expert on viruses, who calls his other world expert friends on viruses, and they say take the medication, and I'll tell you something more. If you look in the official formulary from China, the book they use to decide how they treat patients, it tells the doctors, instructs them to give the medication. In my family's ancestral home of Turkey, the government confiscated all the pills from pharmacies and it gives it to all the patients diagnosed. Other countries have done the exact same thing. Some countries are starting to think about blocking the export of the product for that very reason. So, for whatever reason, because we don't have a lot of knowledge about how to treat COVID-19, and it's one of the ideas that seems to have some traction, it's attractive to physicians. So anecdotally, plus based on these trials, I think most clinicians understandably desire it as their favorite first drive.